Hey, it's Dr. Kre. Welcome to the Dr. Kre and Me show. It is December 18th today. We're going to talk about 6 reasons for female hair loss. So there are 6 reasons tonight that we're going to discuss for female hair loss. Welcome. Let me know when you are here and who you are. And we're going to get started. About 5 minutes late, but I was at a nursing home. But I am here. I'm here now. Sorry. All right. Tonight we're going to talk about 6 reasons for female hair loss. And we're going to get started. You know who I am. I'm Dr. Kre. I am a board certified family medicine physician, and I specialize in what's important to you through my telehealth and my concierge medicine practice. And I also have a booming practice here in Birmingham, Alabama, Brownstone. I help to teach patients that are my patients and that are not my patients how to live healthier, happier lives. I want to educate you so that you know all about your body, so that when you go to your doctor, you'll be prepared. You'll know what questions to ask. You'll know what concerns to have, if there are any concerns. And just from there, I just want you to be healthy and happier. Hey, Miss Nikki, how you doing? Hey, Tanya, how are you guys doing? Birmingham is checking in. Let me know where you are, who you are, and where you're checking in from. So tonight we're going to talk about 6 reasons, for female hair loss. Number 1 is hypothyroidism. Hey, how you doing? Miss Banks, you doing okay tonight? Number 1 is hypothyroidism. So remember, we did a talk before about hypothyroidism. And remember, hypo is when your thyroid slows itself really, really down and your number is actually high, more than 4. Or hyperthyroidism is when your thyroid is moving really, really, really fast and your number or lab is low. So when it's low or slow functioning, actually can have some hair loss. Women complain that their hair are dry and brittle, and that when they comb it or in the shower, they get to see a lot of hair loss in the shower or in the tub or whatever. So that's brittle hair and hair loss. Hey Dave, thanks for being my note taker. Hope you and Denise are feeling better. All right, number 1 is hypothyroidism. Number 2 is lupus. So let's talk about this. There are several kinds of lupus. One is systemic lupus that is all over your body. Your labs are positive. It may affect your kidneys, it may affect your eyes, it may affect your heart, it may affect wherever. But this type of lupus that can cause your hair to fall out is discoid lupus. DISCOID, discoid lupus. So discoid lupus, a lot of times, hey Destiny, a lot of times when people have discoid lupus, they have what's called a butterfly rash. So it kind of spares here, and then they have a rash that goes right there. And it's usually red and really, really red, or look like just red in Caucasians. And then it can be palish or dark in African Americans. So discoid lupus can present as a rash on your face, and it also can present as hair loss. So a lot of times the woman is in her like late 30s, mid 40s, and they'll start to say, hey, I'm starting to have some hair loss. So usually you go to your primary care doctor and you make this complaint. So some of the things that we consider is, how does your thyroid look? Okay, let's check your thyroid. Let's check your iron levels, because anemia can also cause this as well. Let's check your hormone levels. So if all of that is kind of looking like normal, then my next bet is to say, hey, let me refer you to a dermatologist. So you go to the dermatologist. We refer a lot of people to Skin Wellness, Dr. Raina Dick and Dr. Corey Hartman. We send we send people there. Sorry, my screen is creaking. We send people there. And from there, they actually draw, if it's not already been done, they'll draw what's called the lupus panel or the rheumatoid arthritis panel. It checks a lab called the ANA. The ANA, if negative, we just go on about your business. Like, okay, ANA was negative. If it's positive, then it triggers a cascade to check for, other things that could cause cause your body to kind of fight itself. So your body is fighting itself because lupus that's what it causes. So rheumatoid arthritis, the labs check for rheumatoid arthritis. It checks for lupus. Lupus can be caused by some drugs. Some drugs that you can be on can cause you to have lupus symptoms. It can run in your family. And then you got this discoid lupus where your numbers are high, but your joints don't hurt, because lupus can cause you to have joints. No joint pain. Your kidney numbers have been fine. So then the dermatologist will take a biopsy. So a lot of times, if you get to the dermatologist, your complaint is hair loss, and they manage hair loss, they will take a biopsy from your scalp. It's like a little punch biopsy, a little small thing, put it in there, twist it around, pull out. So they want to get part of your scalp and any hair follicles, if there are hair follicles there. So that will show, hey, why is the reason for the hair loss? It may be inflamed scalp from your hairstyles. And then it also can show discoid lupus. It can show psoriasis. It can show all of those kind of things. So usually your primary care doctor will draw the blood. If it doesn't reveal much, then we send you to the dermatologist to get more work. So the diagnosis of lupus is kind of a tough diagnosis because you have to go through several steps. And during this time, the patient is actually pretty frustrated, like, well, why is my hair continuing to fall out? Hey, Sandria, why is my hair continuing to fall out? You're like, that's, we have to wait and see, because it can take the room panel 7-10 days to come back sometimes. Then you have to get the biopsy, which can take it up a week or two to get back. So from the time that you're by the time you tell your doctor about this, hey, Sean, by the time you tell your doctor, you're pretty frustrated by the time a month goes by. So just know that there's a method to the madness. It takes about 10 days for all that to happen. Then to get into the dermatologist, it takes a long time, a lot of times. And then you have to get the lab, get the biopsy sent and evaluated. So number one is hypothyroidism. That's when you have a slow functioning thyroid and you have brittle hair and it just kind of sheds. Number two is lupus, discoid lupus. And number three is what we call traction alopecia. And this is very, very, very common in the African American community. When you get your braids, and we do a lot of protective hairstyles because a lot of us are natural. So a lot of times under your sew-ins or under your crochets or under your whatever your hairstyle is, even under your wig, you may have cornrows. And if you have cornrows, your hair as tight as it can be, and your eyes are being pulled back like this because your hair is pulled so much, that can cause what's called traction alopecia. Gotta mess my hair up, sorry. And alopecia is the medical terminology for hair loss. So you can have it and you pull with your braids. So we have to be careful with doing those protective hairstyles, because it could actually pull more on your natural hair and actually pull your hair. So you take your braids down, you're like, why is my hair falling out? And why are my edges thin now? Because your stylist has pulled and pulled and pulled and pulled to get it tight. Because, you have to get it tight. It's got to be right. We know that. However, be concerned that it can cause you to have hair loss. So if you have a lot of protective styles or sew-ins and crochets and wearing your wig, and that's because you're trying to get your natural hair to grow out. We're trying to grow our perms out and be as natural as possible. Sean and Dave, y'all don't have to worry about these problems, but they exist. So you're doing that, but be mindful that you watch and make sure that if you start seeing white bumps on the side of your hair here or here, and it's really looking like you pulling and your head starting to hurt just because you went and got your hair done, then just maybe that may be too much traction, and say, hey, next time you braid my hair, can you just be careful not to pull it too much, because I don't want to pull my hair out. So that's a conversation to have with your beautician women. Hey, Michelle. So number one, hypothyroidism. Number two, lupus. Number three is traction. which is, yeah, traction, alopecia. Thanks, Dave. Number 4, it could be hereditary. So oddly enough, you can have balding just like your dad. So a lot of times women may have the balding pattern because it was passed down from them to from their fathers to them. So a lot of times when women are having a complaint, I'm like, well, what does your family hair look like? Who did your mom lose her hair? Did your granddaddy lose their hair? Who lost hair? Whose hair is thin? And that's hair that is more central crowning, hair loss here, and it's just thin. Like I remember when we were little, Sandra, remember Mama used to have a piece right here because all of the rest of her hair was pretty full, but right here was a little bit thinner. So she had Mel to sew her in a little piece right here and curl it so it looked just as full as the rest of her hair. Well, that probably wasn't the best because all that sewing right up in there over that little, peach fuzz probably was not helping that hair to kind of rejuvenate itself. So when people come to me and they say they have hair loss, one of the things that I'm looking for is, you see how at the top of my head, you can see follicles. It's dark there. You see hair follicles. You don't see like plugs. You don't look and see like, oh, that's plugs. You see hair everywhere. Hey, Maggie. You see hair everywhere. So when you are having true alopecia, you actually see plugs, and in areas there is no hair follicles. There's no like a man's beard. When a beard starts coming in, you can see the follicles or the openings. You should see that in the top of your head. If I come in and rip a plug out my hair, soon you will see that I have the follicles are showing that there's regrowth. Well, if it's smooth as a baby butt, hey, Miss Yetta, if it's smooth right there and you don't see any signs where hair ever was, then you probably have some issues with alopecia. So 1 is hypothyroidism. 2 is discoid lupus. 3 is traction from those awesome hairstyles you guys are getting. 4 is hereditary. 5 is polycystic ovarian syndrome. And one of my friends today was reminding me that she was told, a lot, which sounds contraindicated because women with polycystic ovarian syndrome or PCOS, they have a lot of hair. They have, almost beards here. They have hair all on their chest. They have this long hair on their legs. They got hair all over their arms. But then they'll have thinning of the hair on the sides. They can have thinning. Then the hair can thin out on the sides. So polycystic ovarian syndrome can thin you out on the sides. What also can thin you out on the sides is pregnancy. When I was pregnant with Zoe, my hair came out just a little bit on the sides. And I was asking my hairdresser, like, my hair is falling out. Something's wrong with my hair. She's like, well, maybe not. But sure enough, after I had her, now my edges are back. They're back laid now, okay? So 1 is hypothyroidism. 2 is discoid lupus. 3 is traction from your hair, all of your hairstyles or your protective hairstyles a lot of the times. 4 is hereditary. 5 can be polycystic ovarian syndrome. Number 6, I'm adding in number 6 is pregnancy, and it can do it right around the edges as well. Even though you on that prenatal vitamin and your nails are so long, your hair back here may be very long, but you can have the thinning around your temples. Hey, Mama Rudolph, thinning, right around there. You see, I'm trying to get my hair right because I'm all digging in it, trying to teach y'all. So, number 6 is pregnancy, and then a bonus is psoriasis. So people with psoriasis can actually they can get psoriasis in their scalp. And I mean, it looks like dandruff. Hey, Tanya. It looks like dandruff. And it's like patches of white circles or just patches. Hey, Matt. Patches of white, thick. You're like, I got real bad dandruff. Well, it may not necessarily be dandruff. It could very well be psoriasis. So if you're like, we've done all the tea tree oil and all the things that we're supposed to do to kind of work with the dandruff, and it's still there, you may need to send that patient, or as a patient, you may need to go to the dermatologist. Have that area biopsy. Remember I said it's usually a punch biopsy, a little small thing. Almost look like a cigarette lighter, but it's smaller. And they sit it, numb you up a little bit, sit it there, push down. And when they push down, they do this sensation here, and it takes up a little bit of your scalp. It'll have hair and your scalp included. And then you may have to do a little stitch in there to close it up. So just know that there are several reasons that if you're a woman, that your hair could be coming out. Thyroid disease, hypothyroidism, discoid lupus, traction from your hairstyles, hereditary. You do with your dad balding, so does that mean you're bald? 5, polycystic ovarian syndrome. 6, pregnancy. And 7, psoriasis. So let's talk about some of the things that we can do to treat and to reverse some of these hair loss. So hypothyroidism, a lot of times the hair comes back in fuller and thicker once your levels are brought back down to normal. So once your levels are good, so we're going to treat the thyroid disease. Hey, hair's growing back again. For discoid lupus, if you're having a lupus flare, you may have to be put on steroids. So they'll do high dose steroids by mouth, and sometimes I have to do steroid injections in your head, because if it's really bad and inflamed, they need to kind of get that down, and a steroid can help with the inflammation, cool things off in your scalp. So steroids, and then once you've been treated with the steroids, everything comes down. You may have to be on a medicine that's called Plaquenil. So Plaquenil treats lupus, but before you can take Plaquenil, you have to have your eyes checked because it can affect your vision. So Plaquenil, and then if you have it really, really bad, there are things like methotrexate and all of that's out there. So just be mindful that you may have to take some steroids to kind of cool that scalp down. For the traction alopecia, the treatment in itself is going to be making sure that you don't continue to just do your hair as tight as they had been doing. And say, hey, girlfriend, I know we want this to last for 2 months, but I want my edges. I need my edges. So hereditary, there really is not much you can do about that. You know it's going to happen. Find you a way to embrace that this is really happening. And get you some good wigs or whatever, and be mindful and try not to add to making your hair come out, because you already have the hereditary aspect. Don't add the traction aspect in there trying to figure out how to cover it up. Hey, Miss Coleman. Call the office. Let's see. Hereditary PCOS. So polycystic ovarian syndrome, the treatment for it is a lot of times is metformin and trying to get your hormones in line. So you may have just a little bit on there. Hey, Tiffany. Hey, you may have just a little bit of thin in there. Hey, Vicky. Thin it right here in your scalp with the PCOS, but that's going to all be hormonal. And if you have psoriasis, there are medications for psoriasis to be treated. A lot of my patients are on like some topicals. And, you rub the topical on there, wash it. Hey, Dr. Lakeisha. Washing it and putting topical steroids on there. Seeing the dermatologist. Going into the light box. So psoriasis is kind of tough to treat. So just so we know. 1, hypothyroidism is a cause, which is when your number is high, but all your symptoms are sluggish. You got hair loss, brittle hair, dry skin, weight gain. Discoid lupus is the next one. Traction from the way we're doing our hair and our braids and all of that. So be mindful. Hereditary and PCOS and psoriasis. So anybody have any questions tonight about the protocol? So really, you start to lose your hair, you notice it. In the sink, on the floor, in the shower, however. When you start to notice that you're losing your hair. So then you say, let your primary care doctor know. They usually run some labs. They'll check your iron, they'll check your kidneys, they'll check your liver, they'll check your, they said reason number 1 for male hair loss, women. We worrying y'all to death. Mm-hmm. So, they'll draw blood, check your thyroid. Maybe depending on your history and your family history, check what's called a rheum panel. We'll check your ANA for lupus, rheumatoid arthritis. We'll check you for all of that. And then from there, you'll probably get the referral to a dermatologist if your primary care doctor doesn't do the biopsies. I don't do the I don't biopsy the scalp. I let the professionals do that. So we do a referral for them. And then after that, you will be referred, if you have the lupus or psoriasis, you'll likely be referred between the dermatologist and the rheumatologist. Rheumatologists deal with your joints and those autoimmune, where your body fights against itself, autoimmune diseases. So there is a plan of action. And the biggest thing is that while we're trying to, hey Sammy, while we are trying to not, to be cute, make sure we're not pulling our hair out. Okay, Destiny has mom wants to know, will you lose weight with thyroid issues as well? Yes. So if you have hyperthyroidism, that means your thyroid is like going too fast. A lot of those people lose weight too. But if you're on medications for hypothyroidism and you're on too much medication, it can cause your levels to be too suppressed, and your medications may need to be adjusted. If you're on thyroid, like Synthroid or levothyroxine. Hey Shauna, if you're on Synthroid or levothyroxine, you just need to know that if you got too much of a dose on board, you can lose weight and have a fast heart rate. But that might be that your medications need to be adjusted. Like you may need to come off of some of your dose. Any other questions? So we got our 6 reasons. Next week is going to be Christmas Eve. So I won't be live. I won't do my live on Christmas Eve. I will be back. Maybe I won't be back. Maybe I'll come back later in the week. I may come on Wednesday, the 27th. What y'all think? Would y'all come back on Wednesday, the 27th? And we'll talk then. See how you doing. Make sure you don't have the Christmas blues. But in the meantime, let me know. We got people from everywhere watching. I appreciate that. Oh, she said thank you. Okay. I know we won't be here, so I'm going to give y'all time to be with your families, and I'm going to be with mine. And get Zoe ready for Christmas. So let's say I'll come back next Wednesday. Maybe we'll do Wednesday the next 2 weeks so we won't miss the Dr. Kre Me show. We'll just revamp our schedule. And just look in the group, and I'll post it here and on the Brownstone page so that you can know when we'll meet for the next 2 weeks. But if there are no other questions, you know who I am. I'm Dr. Kre. I am a board certified family medicine physician, and I specialize in what's important to you through my dynamic medical practice here in Birmingham, my telehealth segments, my concierge practice. I help you as a patient learn to live a healthier, happier, well-informed life. So I want you to know that when you know better, we actually do better. And find me, of course, on Facebook at Dr. Kre. That's DOCTORKRE. Tag the post, share the post. And also, if you want to do a discovery session with me, you can go to www.drkre.as.com. I'll put the link in the thread, and if we, do a session on whatever you want to talk about. So anyway, I'll talk with you soon. But yes, I will link to my discovery. I'll post a link for the discovery sessions with me if you want to chat further. Anyway, talk to you soon. I hope you have a Merry Christmas. I hope you remember that Jesus is the reason for the season, and Merry Christmas. Good night.